Hello future doctors, welcome back to Anatomy Ki Duniya. I am Himanshu Bislani, doing MBBS first year from Jawaharlal Nehru Medical College, Ajmer. So today we will starting with our very first topic of head and neck, that is skull. So let's start. So today we will be starting with skull. This is the first topic of head and neck, basically important for practical purposes, basically asked in Viva. So, the skeleton of head is called the skull. It consists of several bones that are joined together to form the cranium. The term skull also includes the mandible or the lower jaw, which is separate bone. We will study the mandible in the later videos. However, the two terms skull and cranium are often used synonymously. The skull can be divided into the two main parts, the clavidia or the brain box or the neurocranium is the upper part of the cranium which encloses the brain. It consists of skull cap or the vault and a base. The second part is the facial skeleton or the viscerocranium, constitutes the rest of the skull and includes the mandible. So from this diagram you can clearly identify that the skull comprises of two parts, that are the neurocranium and the viscerocranium. The upper one is neurocranium and the lower one is the viscerocranium. So now we will discuss the bones of the skulls. See, this one is the skull. The skull comprises of basically paired bones and unpaired bones. The clavidia or the brain case composed of 14 bones. This one is the frontal bone. This one is the frontal bone. This one is the parietal bone. Parietal bones are paired. This one is an occipital bone. Now this one is a temporal bone. The other paired bones are the malleus incus and stapes, which are present in our ear. Now coming to the facial skeleton. The facial skeleton consists of 14 bones. Total bones are 28. 14 are divided into each part. This one is the maxilla, which is a paired bone. This one zygomatic, which is again a paired bone. This one is lacrimal bone. You can easily visualize this bone. This one is a palatine bone. Let me just hide this mandible. Okay, this one is the palatine bone. This one is the vomer bone, which is unpaired. So now you can easily visualize all the bones of the skull. Let me just again repeat all the bones. The skull consists of 28 bones, which are named as follows. The clavidia or the brain case is composed of 14 bones, which includes paired and unpaired. The paired are parietal, temporal, malleus, incus and stapes. The unpaired are frontal, occipital, sphenoid and ethmoid. The facial skeleton composed of 14 bones. Paired are maxilla, zygomatic, nasal, lacrimal, palatine and inferior nasal concha. The unpaired are mandible and vomer. Now coming to skull joints. The joints in the skulls are mostly sutures, a few primary cartilaginous joints and 3 pairs of synovial joints. Now what are sutures? Sutures are the fibrous bands of tissue that connects the bones of the skull. There are two pairs of synovial joints are present between the ossicles of the middle ear. One pair is the largest temporomandibular joint. This mobile joint permits us to speak, eat, drink, and laugh. Now coming to anatomical position of skull. The skull can be placed in proper orientation by considering any one of the two planes. First one is the reed base line. It is a horizontal line obtained by joining the infraorbital margin to the center of the external acoustic meatus, that is the auricular point. The second one is the Frankfurt horizontal plane of orientation, which is obtained by joining the infraorbital margin to the upper margin of the external acoustic meatus. See, this one is a reed base line from infraorbital margin to the middle of the external acoustic meatus. This one is the Frankfurt horizontal plane, again from infraorbital margin to the upper part of the external acoustic meatus. The reed base line will be slightly oblique to the Frankfurt horizontal plane. So now how we will study the skull? What are the various methods of studying a skull? What are the various views of to study the skull are described here. First one is the superior view, that is the norma verticalis. Posterior view, that is the norma occipitalis. Anterior view, that is norma frontalis. Lateral view, that is norma lateralis. Inferior view, that is norma basalis. The most important is the norma basalis. The whole skull can be studied from the inside or the internally after removing the roof of the skull. The internal surface of cranial wart can be studied. The internal surface of the cranial base, which shows a natural subdivision into anterior, middle, and the posterior cranial fossa, can also be seen. The skull can also be studied as individual bones. Mandible, maxilla, ethmoid, and zygomatic, etc. have been described. See, this one is the internal surface of the cranial base, which is subdivided into three parts: the interior cranial fossa, the middle cranial fossa, and the posterior cranial fossa. See, you can now easily visualize. This one is the anterior cranial fossa, this one is the middle cranial fossa, and this one is the posterior cranial fossa. So now coming to some of the peculiarities of the skull bone. First point is that the base of the skull ossifies in cartilage while the skull cap ossifies in the membrane. So what is the meaning of this point is that basically all the bones, majority of the bones in our embryonic life are first ossifies from the cartilage, while some bones ossifies from the membrane, which means that these bones ossifies from the connective tissue. Second point is that at birth the skull comprises one table only. By 4 years or so, two tables are formed. Between the two tables there are diplos, that is the spaces containing red bone marrow forming RBCs, granular series of WBCs, and platelets. Four diploic veins drain the formed blood cells into the neighboring veins. At birth, the four angles of the parietal bone have membranous gaps or the fontanelles. These allow overlapping of bones during the vaginal delivery if required. These also allow skull bones to increase in size after birth for housing the delicate brain. So now what are the fontanelles? A space between the bones of the skull in fetal stage. These spaces are basically, so you can see this diagram. These are the fontanelles present on the four angles of the parietal bone. These are the anterior fontanelle, posterior lateral fontanelle, anterolateral fontanelle. So now coming to the fourth point, some skull bones have ear cells in them and are called the pneumatic bones. Example, the frontal and the maxilla. They reduce the weight of the skull. They maintain humidity of inspired air. They give resonance to voice. These may get infected, resulting in the sinusitis. So, during your NEET preparation, you have learned about that the birds, the aves, they contain the pneumatic bones. Basically, to reduce the weight, the birds have pneumatic bones. The skull bones are united mostly by sutures. See this; these are the sutures. Skull has a foramina for the emissary veins, which connect intracranial venous sinus with extracranial veins. So this point will not be understood now. We will understand in the next chapters. Petrous temporal is the densest bone of the body. It lodges internal ear, middle ear, including three ossicles, that is malleus, incus, and stapes. Ossicles, ossicles are bones within the bone and are fully formed at birth. Skull lodges brain, meninges, CSF, glands like hypophysis cerebri or the pituitary gland, and pineal, venous sinuses, teeth, special senses like retina of eyeball, taste buds of tongue, olfactory epithelium, cochlear and vestibular nerve endings. So now first coming to the first view of the skull, that is the norma verticalis. So first I will read all the important points and then I will show you by the 3D animation. So what is the shape of norma verticalis? When viewed from the above, the skull is usually oval in shape. It's wider posteriorly than anteriorly. The shape may be more nearly circular. See, this one is the norma verticalis or the superior view of the skull. From the posterior, it is wider. See this one. And anteriorly, it is narrower. So now what are the bones included in the norma verticalis? The upper part of frontal bone is on the anterior side, uppermost part of the occipital bone posteriorly, a parietal bone on each side. Now what are the sutures present on the norma verticalis? First one is the coronal suture. This is placed between the frontal and the two parietal bones. The suture from side to side and runs downwards and forwards. See, this one is the coronal suture. Now coming to sagittal suture, it is placed in the median plane between the two parietal bones. See, this one is the sagittal suture, which is present between the two parietal bones. Now third one is the lambdoid suture. It lies posteriorly between the occipital and the two parietal bones, and it runs downwards and forwards across the cranial vault. See, this one is the lambdoid suture. You can see more clearly from the norma occipitalis. This one is the lambdoid suture, which is present between the two parietal bones and the occipital bone. So now fourth one is the metopic suture. This is occasionally present in about 3 to 8% individuals. It lies in the medial plane and separates the two halves of the frontal bone. Normally it fuses at it is present in the skull. It will lie somewhat here. And it generally fuses at 6 years of age. So now coming to some other name features of the norma verticalis. First one is the vertex, which is the highest point on the sagittal suture. Second one is the vault of the skull, is the arched roof of the dome of the skull. Bregma is the meeting point between the coronal and the sagittal suture. Fourth one is the lambda, which is the meeting point between the sagittal and the lambdoid suture. Fifth point is the parietal tuber eminence or the parietal eminence, which is the area of maximum convexity of the parietal bone. This is the common site of the fracture of skull. Sixth one is the parietal foramen. One on each side pierces the parietal bone near its upper border, 2.5 to 4 cm in front of the lambda. The parietal foramen transmits an emissary vein from the veins of scalp to superior sagittal sinus. Seventh one is the obelion, which is the point on the sagittal suture between the two parietal foramina. The temporal lines begin at the zygomatic process of the frontal bone, arc backwards and upwards, and crosses the frontal bone, the coronal suture, and the parietal bone. So now I am again repeating all the name features. First one is the vertex, which is the highest point on the sagittal suture. See, this one was the sagittal suture. Here, somewhat here, is the presence of vertex, which is the highest point on the sagittal suture. Second one is the vault of the skull, which is arc roof of the dome of the skull. Third one is the bregma, which is the meeting point between the coronal and the sagittal suture. See, this one is the bregma, which is the meeting point of coronal suture and the sagittal suture. Next point is lambda, which is meeting point of the sagittal suture and the lambdoid suture. See, this one is the lambda. You can again clearly visualize this. This one is the lambdoid suture. This one was the sagittal suture. This point is the lambda. The fifth point was parietal eminence, which will be clearly seen from the 3D view. I will show you. Sixth one is the parietal foramen. See, this one is the parietal foramen. And between these foramen is the presence of obelion. Now coming to temporal lines. These are the temporal lines, which begin at the zygomatic process of the frontal bone. See, you can see this from the norma frontalis. I will show you in the later videos. Now we will go to 3D view. So now you can easily understand all the landmarks of the norma verticalis. I am again repeating. The norma verticalis consists of a frontal bone, two parietal bone, and a occipital bone. So the front suture is the coronal suture, the middle one is the sagittal suture, and the posterior one is the lambdoid suture. Meeting point of coronal and sagittal suture is the bregma, and meeting of sagittal and the lambdoid suture is the lambda. The highest point on the norma verticalis is the vertex. This one is the parietal eminence, and here is the presence of temporal lines. See, the temporal lines arise from the zygomatic process. See, this one is the zygomatic process. From here the temporal line arises. See, you can easily visualize this. A line is going on here. So now we will discuss all the name features of the norma verticalis. The norma verticalis consists of the frontal bone. This one is the frontal bone. This one is the frontal bone. Two parietal bones. These are the parietal bones. And the occipital bone. This one is the occipital bone. Now coming to sutures. This one is the coronal suture, which is present between the frontal bone and the two parietal bone. The middle one is the sagittal suture, which is present between the two parietal bones. And the third one The posterior suture, which is the lambdoid suture, which is present between the two parietal bones and the occipital bone. Now coming to all the pinpoints of the norma verticalis. First one is the brachma, which is the meeting point of the coronal and the sagittal suture. This one is the brachma. Second one is the lambda, which is the meeting point of the sagittal and the lambdoid suture. So this one is the lambda present posteriorly. Now coming to vertex. So the highest point of the norma verticalis, which is best seen from the norma occipitalis, is the vertex. So highest point, you can see the most highest point is the vertex. See, this one is the highest point. The uppermost point of this arc is the vertex. Now coming to the oblion. See, there is a straight line, somewhat straight line here between the two zigzag lines of the sagittal suture. Which one is the oblion? And on the both sides of the oblion, there is a presence of parietal foramen, from which the emissary vein passes. In this diagram, there is no parietal foramen, but from the book you can easily identify that there is a presence of two parietal foramen. Now coming to the temporal lines. So the temporal lines arises from the zygomatic process of the frontal bone. See, this one is a frontal bone, and this one is the zygomatic process. This one. So the temporal lines arise from, see, you can see a line going on here. A curved or arced line going on here. These are the temporal lines. There are two temporal lines, superior and inferior. And there's a presence of convexity, that is known as the parietal eminence. See, this one is the convexity. So I've covered all the main landmarks of the norma verticalis. So now coming to the clinical anatomy. So the clinical anatomy of the norma verticalis is the first point is the frontanels are the site of growth of skull, permitting growth of brain and help to determine age. The second point is if frontanels fuse early, the brain growth is stunted, such children are less intelligent. If anterior frontanel is bulging, there is raised intracranial pressure. If anterior frontanel is depressed, it shows decreased intracranial pressure, mostly due to dehydration. Bones overwrite at the frontanel, helping to decrease size of head during the vaginal delivery. Now this one is the important point. The corpus succedaneum is soft tissue swelling on any part of the skull due to rupture of the capillaries during delivery. Skull becomes normal within a few days of postnatal life. See what does happen in corpus succedaneum when there is a rupture of capillaries during delivery occurs. It seems like the brain is not fully developed. That's all for today. Hope you liked my video. So for today's task is you have to tell me that how many frontanels are present in a skull and which frontanels are present on the brachma and the lambda. For today's homework, you have to just go through all the landmarks or the pinpoints of the norma verticalis, and you have to learn all these points, because these points are very important when you will face viva in front of your examiner. So that's all. Hope you like my video. Share this video to everyone, all the future doctors, and do like, share and subscribe to my channel, and please click on the bell icon to get the latest update. Thank you.